Hello students, good morning. So yesterday class we discussed with respect to the liver toxicants like formaldehyde, ethanol and other toxicants, other drugs which causes the toxicity or the damage to the liver cells. Those are called as hepatocytes, right? Now let us move on to the next toxicant in the liver toxicity, that is aflatoxins. So these are a group of structurally related toxic compounds which are mainly produced by certain strains of the fungi, that is Aspergillus flavus and Aspergillus parasiticus. So where this particular aflatoxins causes poisoning, that is called as aflatoxicosis. This poisoning, which results mainly from the ingestion of this aflatoxins in contaminated food, through the contaminated food it may affect, and also the exposure to these toxicants in the working places can also happen. Among 18 different types of aflatoxins which are going to be identified, major members includes aflatoxin B1, B2, G1 and G2. Aflatoxin B1, which is going to act as a most toxic and most prevalent among this family members of aflatoxins. So now let us see what is the mechanism of this toxicity. The major target for this toxicity of this aflatoxin is the liver, wherein oxidation, which is going to happen by the cytochrome P450 monooxygenase enzyme, as we have discussed in the last classes with respect to these enzyme slides. So these aflatoxins which are going to bind, how this is going to happen? They are going to bind to the DNA or protein C1, and which is going to impair their functions. So these aflatoxins which are going to produce further necrosis of the liver cells, causes necrosis to the liver cells, that is nothing but damage to the liver cells, that is mitochondria, and even proliferation of these bile ducts can happen. So these toxins which also suppresses the immune system of the body. Of course, what are the signs and symptoms of this aflatoxins exposure? Vomiting in the individual who is going to face all these symptoms: vomiting, abdominal pain, mental impairment, convulsion, hemorrhaging, disruption of the food digestion and metabolism, and even liver damage you can notice, and coma. Lastly will be the coma. He or she results in the coma. So how you are going to manage this? What is the management of this aflatoxins exposure? Main FDA's goal is to for this aflatoxin which has to be minimized, and contamination by the cause, we need to observe what is the cause for this contamination, and we have to give some supportive treatment, and there is no specific antidote for this toxicity as we have observed in the last toxicants. Specific antidote in order to treat this toxicity of aflatoxins, but timely administration of this methionine amino acid 200 mg per kg of the body weight, and sodium thiosulfate, that is approximately 50 mg per kg of the body weight at 8 hours intervals, which we can provide, and it is also proving to be a therapeutic value. It is having its own therapeutic value. So this how we can administer to the patient who is exposed with this aflatoxin chemical. So what are next? The question comes here is, what are some of the common liver function tests which we can do it in order to test whether the liver is functioning well or not? So you can make a series of special blood tests for this in order to determine whether the liver is functioning properly or it is damaged. So these tests what we are going to perform, which also distinguishes between acute and chronic liver disorders, and also between hepatitis and cholestasis. But the most commonly performed blood tests includes likewise, that is, first will be serum bilirubin test. How this test is going to be performed? So this test specifically helps in order to measure the levels of the bilirubin in the blood. This bilirubin is going to be produced by the liver and is excreted in the bile, where the elevated levels of this bilirubin, which is going to indicate an obstruction of the bile flow or a problem in the processing of this bile, mainly done by the liver. So this how you can make in order this test in order to measure the levels of bilirubin content in the blood. How you are going to test this albumin? So this test is also mainly used to measure the levels of the albumin or the protein in the blood, which is going to aid in the diagnosis of the liver disease, especially serum alkaline phosphatase test. This is one of the very important tests which is used to measure the levels of the alkaline phosphatase enzyme in the blood. This is going to be found in the enzyme tissues with highest concentrations in the liver as well, and biliary tract, and even bones also. So this test, which can be performed in order to assess the liver functioning and in order to detect the liver lesions which may further cause biliary obstructions, such as by the tumors or abscesses, by the formation of tumors or abscesses, which we can notice the particular test whether the liver is functioning properly or not. Serum aminotransferase test. This is one of the tests which is also called as transaminases. This particular enzyme is going to be released from the damaged liver cells. From this damaged liver cells, if the enzyme is going to be released, of course it is very easy to detect in the blood test, serum blood test. If we indicate this presence of this transaminase or the aminotransferase enzyme, of course the liver is damaged, which we can predict. Coming for the PTT test, that is also called as prothrombin test time or prothrombin time test. This test measures how long it takes for the blood to clot. Of course, we have already seen, you have studied in case of physiology also in detail. So this is going to be a very important test in order to measure how that particular clot is going to take long time or less time. Blood clotting, as you all know, it requires mainly vitamin K and a protein which is made by the liver. This prolonged clotting, it indicates a liver disease or other deficiency also in specific clotting factors. Coming for the next ALT test, that is also called as alanine transaminase test. This is a very important test in order to measure the level of the alanine aminotransferase. As such, we have observed in case of aminotransaminase or aminotransferase, which is the enzyme found predominantly in the liver, of course. This is going to be released into the bloodstream after the acute liver cell damage. Only after the acute liver cell damage you can make out the presence of this enzyme, which is going to be released into the bloodstream from the liver. So this test mainly done in order to assess the liver functions and also to evaluate treatment for the acute liver diseases such as hepatitis. Hepatitis can be tested, diagnosed, and we can treat this. Coming for the next AST test, that is aspartate transaminase test. This is a test very importantly we are going to do in order to measure the level of the aspartate substrate, that is transaminase enzyme. This is an enzyme which is found in the liver, of course, kidney also, pancreas also, heart also, skeletal muscles also, and even the red blood cells contains this enzyme, that is AST. This is also going to be released into the bloodstream only after the liver or the heart problems arises. If the presence of this enzyme in the bloodstream, if you are noticing, then we can predict that the liver is damaged. Coming for the gamma glutamyl transpeptidase test. So this test especially done to measure the level of gamma glutamyl transpeptidase, which is an enzyme mainly produced in the liver, pancreas, and even the biliary tract. So this is performed in order to assess liver function, which gives you information about the liver diseases, and it also helpful in detecting the alcohol ingestion, whether the amount of alcohol, how much amount of alcohol has been taken by the patient daily. So that can also be detected. Then coming for the next, lactic dehydrogenase test. So this test which helpful in detecting the tissue damage, and as well as it also aids in the diagnosis of the liver diseases. So this is a type of a protein which is also called as isoenzyme. We have already come across LDH, lactate dehydrogenase, which is mainly involved in the body's metabolic process, as you all know, that is conversion of pyruvate to lactic acid. So if this enzyme is not working properly, of course you can see more amount of lactic acid which is going to be, that is if it is active, that particular more amount of lactic acid which is going to be accumulated in the blood. So you can make out that also, in which will help you in the diagnosis of this liver disease. This is an isoenzyme. Coming for the nucleotidase test, 5' nucleotidase test. So this test is helpful in measuring the level of the 5' nucleotidase, which is an enzyme specific to the liver. This nucleotidase level is going to be elevated in the person with this liver toxicity or the liver diseases. Especially the person with this disease is mainly associated with cholestasis disease, that is nothing but disruption in the formation of the or obstruction in the flow of the bile to the liver. So in this case we can notice this particular enzyme is going to be, enzyme levels will be elevated in the person with this kind of disease, that is cholestasis. Coming for the alpha fetoprotein test, that is a specific blood protein which is mainly produced by the fetal tissue and also by the tumors especially. This test is going to be performed to monitor the effectiveness of this therapy in certain cancers such as hematomas. That is, in those patients who is suffering from this cancer or hematomas or tumors, we can detect this presence of alpha fetoprotein test, the presence of this blood protein, which will indicate the presence of the tumors or any kind of cancers such as hematomas. Coming for the mitochondrial antibodies test. So this test is mainly used in order to detect the presence of these antibodies, which can indicate primary biliary cirrhosis, chronic active hepatitis, and even certain other autoimmune disorders. So all these tests which we are going to perform in order to diagnose the liver toxicity, at which level and what kind of liver diseases. So this completes liver toxicity and its diagnosis test. Thank you. Next we will move on to the kidney toxicants or kidney toxicity.